What if the itching you're feeling is actually your microbiome and hormones asking for help right now?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. Today we're unpacking what causes vaginal and vulvar itching, how to tell the difference between common triggers, and the safest steps you can take to calm symptoms while protecting long-term health. I'm Ethan Foster, and I'll guide the key questions so you can pinpoint what's happening faster.
I'm Alara Sky, and I'll walk you through the telltale signs, practical relief strategies, and when testing is necessary. You'll hear exactly what to do and what to avoid, based strictly on clinical patterns and careful care of your skin barrier and microbiome.
Let's start with location, because that drives everything. When you say vaginal itch, you might actually mean the vulva, your external skin, inner and outer labia, and clitoral area. Vulvar tissue is thinner and densely innervated, so it reacts strongly to fragrances, detergents, and heat. The vagina is internal and maintains a slightly acidic pH, about 3.8 to 4.5, supported by lactobacillus bacteria. When pH drifts higher from antibiotics, hormonal shifts, or semen, organisms like Candida or Gardnerella can overgrow and cause internal burning, discharge, and itching.
Here's the quick map of most common causes. Yeast infection typically brings intense itching, burning, redness, and a thick white discharge that looks like cottage cheese, often after antibiotics, tight clothing, pregnancy, stress, or uncontrolled blood sugar. Bacterial vaginosis is different. A thin gray or white discharge with a fishy odor, often stronger after sex, with pH above 4.5 and sometimes only mild itch. Trichomoniasis, a sexually transmitted infection, can present with itching, burning, and a frothy yellow-green discharge with a strong smell. Other STIs, chlamydia, gonorrhea, herpes, genital warts, can also produce itching, pain, or unusual discharge, which is why testing matters.
Dermatitis is a frequent culprit when the itch feels surface level and tied to products. Contact irritation from scented soaps, detergents, panty liners, wipes, or contraceptives can flare quickly. Skin conditions such as lichen sclerosis, eczema, or psoriasis can create chronic itch, soreness, or white thinned patches. And when estrogen drops, especially around menopause, atrophic changes lead to dryness, a higher pH, and more irritation or pain with sex.
If you're trying to distinguish patterns, think in features. Yeast tends to severe itch with odorless, thick discharge and normal pH. Bacterial vaginosis shows thin discharge with a fishy smell and elevated pH. Trichomoniasis points to frothy yellow-green discharge with strong odor and elevated pH. Dermatitis often has minimal discharge but burning or redness at the skin surface. Chronic variable discomfort suggests a skin disorder that needs evaluation.
When relief can't wait, start with the fundamentals. Rinse gently with lukewarm water, only, no hot showers, scrubbing, loofahs, or feminine washes. Pat dry with a soft towel. Switch to breathable cotton underwear and avoid tight synthetic layers that trap heat and moisture. Choose fragrance-free, hypoallergenic detergents and body care. Keep the area dry but not stripped. Allow brief air drying after bathing and avoid talc or harsh drying agents. For comfort, use a cool compress or a brief lukewarm sitz bath.
Just as important is what to stop. Avoid douching, scented soaps, bubble baths, and tight, non-ventilated clothing. Skip panty liners with dyes or perfumes. Do not use over-the-counter steroid or anti-itch creams unless a clinician prescribes them for your diagnosis. Removing irritants lets your skin barrier and microbiome reset, and mild cases often ease within a few days once you've made these changes.
Know the red flags that require urgent care. Seek prompt evaluation for severe pain, marked swelling, or redness. Open sores or blisters, fever or flu-like symptoms, pelvic or lower abdominal pain, foul-smelling or bloody discharge, painful urination, or unexplained bleeding. If you're pregnant, have diabetes, or are immunocompromised. Do not delay care when symptoms arise.
If symptoms persist beyond 3 days, recur more than 3 times a year, or interfere with intimacy, schedule testing. A targeted workup can include a pelvic exam, pap smear, colposcopy to assess for precancerous changes, vaginal pH testing, urine or vaginal swabs for STIs, pelvic imaging when indicated, and biopsy when skin disease is suspected. It's also appropriate to screen for contributors like thyroid imbalance, diabetes, or neuropathic conditions.
Let's connect causes to care pathways so you don't accidentally make things worse. Treating BV with antifungal cream won't help and may irritate you further. Using perfume products on dermatitis keeps the cycle going. Confirming whether pH is elevated and whether discharge features align with yeast, BV, or trach makes your treatment precise and faster.
Internal factors can amplify itch even when infection isn't present. Estrogen declines reduce glycogen and beneficial lactobacillus, raise pH, and thin tissues, which increases sensitivity and susceptibility to irritation. Antibiotics disrupt protective bacteria and predispose to yeast overgrowth. Hormonal contraceptives can shift natural rhythms and contribute to dryness. Antidepressants and antihistamines are known to cause vaginal dryness, and cancer therapies often produce severe vulvovaginal dryness. Elevated blood sugar encourages yeast, and thyroid imbalance affects skin and mucous membranes.
You can support balance with steady specific habits. Focus on appropriate carbohydrate intake, around 250 grams per day if your gut is healthy. Maintain protein at roughly 0.8 grams per pound of lean body mass, and avoid seed oils that disrupt endocrine signaling. Support your microbiome by avoiding unnecessary antibiotics, using probiotics under clinical guidance, and reintroducing fruit with pulp or fiber once gut function stabilizes. Stabilize blood sugar with nutrient-dense meals and consistent timing. Stay hydrated to support mucosal integrity, and avoid alcohol, which impairs liver detoxification and aggravates estrogen imbalance.
Stress fits into this picture too. Heightened stress shifts hormones and immunity, disrupts bacterial balance, and increases skin sensitivity. Rest, consistent sleep, and steady nutrition help blunt stress-linked flare-ups so your tissues can recover.
A quick FAQ pass can reinforce the essentials. Vaginal versus vulvar itch maps to internal microbiome imbalance versus external contact reactions or skin disease. Yeast is thick, white, and odorless with severe itch. BV is thin, gray or white with a fishy smell and elevated pH. Testing confirms the difference. Antibiotics and hormonal shifts can trigger symptoms by altering bacteria and pH. See a clinician if symptoms linger, recur, or pair with pain, fever, sores, or unusual discharge. Gentle, fragrance-free care is what reliably helps at home.
Let's close with a clear next step you can act on today. For the next 3 days, switch to lukewarm water rinses only, wear loose cotton underwear, eliminate all fragranced products, and keep a brief symptom log noting discharge, odor, pH test results if available, and triggers like new detergents or recent antibiotics. If symptoms are not clearly improving by day 4, or sooner if you notice any red flags, book a visit for targeted testing so you can match treatment to the true cause.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.